Put the hole for my cannula.
Yeah. So I will help you. So this technique is for full sagginess, as we said.
Yeah. You already put some lidocaine.
Yes.
We have 2 ml of lidocaine inside this bottle.
So I will put my 1/1 ml like a scientific this here.
Okay.
Exactly.
Hypodermical, yeah?
Very superficial.
Hypodermical, I'm very superficial, trying to see the cannula tip and blanching, like here. In order to be very superficial, Esther, just put your finger like here, exactly. So you are very superficial. Because in this way, because you arrived last. And that's why you don't know a lot of things we already done. The target of this injection, subdermal injection, is dermis.
Yep.
That's why we should be very, very superficial. For the upper structure, for the connective tissue, like ligaments and septa, interlobular,
Are you figuring?
let's put it fire. Okay. So it's, the point of this demonstration is not only to show you the technique, because it's personal, it's possible to personalize, but the point is to show how it's easy to inject this product. How smooth.
So this is 1 ml.
Yeah,
I have 2 more.
exactly.
So 1 here, and then the last one from here. No, from here.
Mm-hmm.
Then second one here.
Okay. Do you have your entry point? Not yet.
But the needle here. Thank you. So you want to show me?
So, I'm not here to show you how to inject the product with the cannula, but to show what kind of protocol we use for this product and why we use it in this way. Okay, very superficial. So now we follow the mandible line, the lower third of the face, trying to reinforce the tissue, be very superficial like here, okay? And we deposit some quantity. Okay. And I advise you to put always something more here because this is the most critical area for our patient. You can also, until here, also here.
One here.
So the last syringe with the cannula,
Should be here.
you can treat from this entry point the marionette area, and you can also go something. You will see. This is the
What do we need?
That's the thing.
I I advise you when you treat Margaret line to dissect with the cannula these ligaments in some way to create the regeneration of the tissue and to create better distribution of the product. Yes, this is a nice idea. And then just deposit the product superficially possibly. Mm-hmm. And I will put something to line.
Long?
Yes, I always try to put it in this line of the edge, one edge. Then we go a little bit down in the program, we will donate everything.
And there is no risk of leaving lines, right?
No, there is no reason. Sometimes, for example, the first patient was treated with a different technique, but she had very thick skin, and at the end we saw lines, but it was only trauma swelling, not and they disappear right after the. So we have the last ml for the left side to place deeply in the periosteum level and into the ligament. So remove all this marking when you are, no, let's start from the
Okay.
no, just to have the same protocol, no?
So here first.
Just perpendicular, go in the bone. Bone. You should do the bone.
Yes, and he's under.
Okay, I see. Just, I aspirate normally, check the amount, 0.25. Just another half. Oh. Okay, that's all.
The second here.
As with the lower fascia ligament, auricular ligament, we say that we don't need to do very deep injection. We just inject these structures in order to reinforce them to create more collagen. It's here. Lower fascia is here.
From to
Exactly this area. Don't go deep, go into the fascia. Okay, enough. We check.
0.25.
Yes, 0.25 in each point. We have 4 points, so we use all and all the products. So again, when you use the mandible ligament, in this patient, by the way, it's very nice situation because the ligament is into the bone. Sometimes, we have also this kind of attachment. You try to pinch the skin and the fish goes down. In this case, just this step. Okay. The bone.
You advise to feel the bone with a needle, yeah?
Yes. Particularly when we go to the wrist stage.
Yeah.
So, this injection probably was already taught to you many times, but try to be don't
Vertical.
just a little observation. You go in this way, angulated. It's not okay because you can go into the piriform aperture. No, but you need to go to the bone. Okay. So, perpendicular. It's crucial to feel the bone.
I see.
Okay. Block with your left hand. In order to block, you can't stay like in this way. You should always stabilize the hand. In this way you can block. Otherwise, and very slowly in this area.
Is there any risk of vascular compromise? Let's say we hit the vessel, it's not a filler.
We can
Could it occlude?
say at 100% that it's impossible. Of course, course, it's always possible, but this phase seems to be safe for the injection when we are in the bone, because it seems, like our anatomist explained, that the facial artery which passes here in this way passes on the roof of the rhizos space, not in the floor, not in the bone, but because in this area it starts to rise in the surface. So that's why it seems to be safe space. But we can't say that it's absolutely safe. That's why anyway, let's aspirate. In this case, with this kind of product, it's not gel, it's an suspension. The aspiration makes sense. With the gel, it's not always makes sense, but with this kind of product, it makes sense. Nevertheless,
it's safe not to go inside the lumen of vessel.
exactly.
It doesn't mean what we have in a film.
Exactly. No, I agree with you, because till now we don't have the, how can I say, the scientific evidence that this product could not occlude. We have no, till now, but we have the success because of the biochemical properties of these microparticles. So they are so fluid, the solution is so fluid that we suspect, but it's not still confirmed, that it's more difficult to obtain vascular occlusion. Anyway, be careful every time, aspirate, try to individuate the position of the artery. If you have ultrasound device, it could be helpful. But anyway, no, I think most of the colleagues still don't use ultrasound. Okay, let's continue.
I think now we
Yes, we need to share some. Who wants?
Thank you very much, Elena.
Welcome. Great job, Esther.
Galbūt nebūtų. Jeigu ypatingai gražiai, nes čiūčiui bus tai patinas labai gražiai. Kitas.
Kiek laiko išėjo? I would like to use everything.
Visų pirma, jau su pamėnų. O tas maksimalus tai 6 mėnesių. Galbūt pasąmonę, alkoholinių gėrimų vartoti ar ne. Tabako, tirščių, baseino, kokias 4 mėnesius.
Our first, do you remember first we performed papular injection for lidocaine?
I already did the lidocaine.
You already done? Yeah. Okay. It depends on many factors, but if we have an ideal patient, so the patient not very old, with very healthy lifestyle, no smoker, no sun, we can expect the result even after 6 months or 6 But I don't know why, but this thing that this product actually gives the result of I don't create big expectation in my patient, and I always say, no market. But they, by themselves, they repair that they have better in better sensations right after the first session. Every 5-6 weeks.
Gidecek pozitif pozitif milletmesi bulunması hamleye
Okay, the main difficulty here in Lithuania is to find the sterile water for injection.
That was a problem yesterday. We heard
Yeah,
about
actually, it was a problem.
that. Only in the one pharmacy shop.
Okay, so first create an entry point, then start with injection of cannula. Just first create. We decided to put one of them in the high zygomatic area and cover this one. The second one in preauricular area to cover this one. And the third one for the marginal line. Okay? 1, 2, and 3. So, by the way, I'm sorry. I don't like this way of creating the entry point. It's crazy, but just to show you and explain why I prefer a different way of creating the entry point. We need to avoid as much as possible the vessels. So if you pinch the skin, you elevate the skin, and all the vessels are down. That's our plastic surgeon confirmed.
Sorry, I just came to take some water, but you were speaking about perforation, yeah?
Just yes, to create an entry point.
Yeah.
This is the first explanation. I prefer to do this in order to avoid as possible vascular damage. It's not damage, but anyway, it would be like bruising. And another point is I want to be perpendicular to the, because when you do in like this angulated way, it will be more difficult to insert the cannula. But you saw how easily we insert it. Sometimes you struggle to insert it because, in my opinion, it's more difficult to pass through doorways. If you are not perpendicular, the length of your path is longer. Well, we talk about anyway, it's okay. But since we are here just to study something new, just to explain. Yes, I prefer this way. Anyway, remember, you are doctors. You have to use your mind, your knowledge, your experience, and of course, if you don't agree, just let me know.
We can discuss.
Yes, we should discuss.
But vertical channel is not so long, so you damage less vessels.
This is my idea. I always did in this way. You insert the cannula as you created your pathway. But you should do it like in the same way. You know, you did it perpendicularly, so go perpendicularly as now. Okay? So you already like. So, but if you of course did this, you go as in your way.
I work so
Yeah.
easy.
It's not a mistake. Yeah, it's not a mistake. It's just my way. A different way of doing things. Try to be superficial, yes, this way. So, without this here,
So the ideal plane is straight under the skin or in the subcutaneous? Is it
straight under the door. Reticularis ligament, exactly. Because what we are looking for are fibers. And they are into the connective tissue. So, ideally, I would like to go to the door.
Dermis, I wanted to ask, those would be the best actually.
Yes, absolutely, it's the best. It's the best. But there are some downsides. First, you need to use the needle. So it will be painful. you will have a lot of bruising. Well, believe me, in some patients, I do it, and I explain, yes, you will have bruising, but you will obtain better results. And if they accept,
If you inject the dermis with the papillus, how long should they last until they disappear?
no papular. You don't need to do papular. You should be
Still don't see anything because of the
careful
camera.
not to do any alteration.
Camera.
It will not be visible.
Usually mine is micropolitics. If it's with the needle.
Like sun technique, with the needle, sun technique, not
Okay.
microbolus.
Okay.
But I didn't say this, forget. This is
Okay,
training,
okay,
so
look.
this is training, so it would be very instructive without
Official recommendation, right?
yes, official recommendation. Afterwards, I said, all of us, we are doctors, we have our experience, we will do, this is the first theory. So you do from the same and the second theory from the it's not a problem at all. Don't create any problem because this is stimulation, not feeling. So remember the second syringe, we insert on this entry point and we treat the mandible area. Okay? So please. Oh, yes. No, because you used to use this now. I don't know if they see anything here. They see nothing. Particularly try to follow the bone margin, so we need to reinforce. We have 1 ml, now we have only half. Now we can add some more gold and as much as you can. Also, we have of course enhance the end. But remember that we will go here also with the intraligamental injection. So work more in this area because here we will put the product with the needle. Let me. Here. Also this area, but more superficially you can so just where did you say it was it was for this no? Because you need to put 1 ml each. So put on the half.
That's less than half, so that's 0.4.
Not a half, but it's
Yes, 0.4.
from here.
From this point, that's sample.
Is the one
But she didn't start from the
Yes. Now, it should have the period.
yeah, no. But I mean, this was the syringe for this area in fact. So, probably I put too few products here. It was not high syringe.
Okay.
So just cover this area. And then we will go to the
Half, yeah? Half only.
yes.
Can you speak one more time about distillation water?
Yeah.
Why?
Why distilled water? Because we tried with sterile water, but the suspension is not so smooth. It's possible, no problem with the patient, but the suspension is less smooth.
Okay,
So
because
you can lose some, like 10% somewhere in the wall, so it's better to use. Anyway, if you ask the patient, it's not burning,
But-
strangely.
but burns is somewhat, I think it can be from a lidocaine because it's not.
Even with lidocaine, it's not burning.
Okay.
Strange, because I tried also in mine. But no, I used to hear my patients screaming when they inject polylactic acid or lidocaine the same. But in this case, we have lidocaine, we have polylactic acid, and sterile water, no sensation, no sensation.
Actually, we do get some natrium chloride, sodium chloride inside the green lidocaine mixed with it, I guess.
Yeah,
A
but
bit
it's
of-
not a problem at all. As I said, it does not create any problem with our treatment, but not to lose some microparticles because the solution is not so homogeneous and probably could rest in some bowl and so on. Just to underline the concept of this treatment, the protocol number 1, we use 3 entry points for the cannula injection, and in each entry point we will put 1 ml of so entire syringe for each entry point. I can understand now it's a little bit confusing because right before we did 1.5 ml for exacto because